What are extrapyramidal symptoms? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent, as well as safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And something that has come up in the comments a few times is asking for more information about extrapyramidal symptoms. And this is a big one, so I think it's worth dedicating a video to. I'm going to keep this as a broad overview, and we can do more specific videos for each of the individual extrapyramidal symptoms. So in general, this is going to be a cluster of medication-induced movement disorders. They're most commonly associated with antipsychotics, especially the typical or the first generation antipsychotics, things like Haldol, perfenazine, thorazine, but they also can occur with the atypical or second generation antipsychotics, things like Abilify, olanzapine, Latuda. Although it's less common, they also can be associated with other psychotropic medications like certain antidepressants and mood stabilizers. Additionally, some somatic medications like Reglan or chlorpromazine can also cause extrapyramidal symptoms. Why does this happen? It has to do with dopamine. Basically, there's different paths in your brain, and when the dopamine activity is reduced in some of the pathways, it can cause a reduction in psychotic symptoms. But when the dopamine is reduced in another pathway, it can cause these extrapyramidal symptoms. So I think about it broadly in two categories. The first is going to be things that can happen acutely or within the first few days to weeks that you've been taking a medication. We typically think about this more with younger individuals, but of course it can occur with older ones as well. But younger people, especially males, are more at risk of these symptoms. The second category is going to be those associated with chronic long-term use or with the use of these medications in the elderly population. So with the shorter-term manifestations of extrapyramidal symptoms, there's going to be akathisia, which is an internal sense of restlessness where people feel like they have to move. It may be manifested by pacing, rocking back and forth, fidgeting, and it can be extremely uncomfortable. And then secondly is going to be the dystonias. So this is when you have an uncontrolled muscle contraction that's sustained, meaning it's not letting up and it's not something you have control over. So for example, torticollis is a dystonia of the neck muscles, and an oculogyric crisis is a dystonia of one of your eye muscles. Then in the chronic category, you're going to have things like Parkinsonian symptoms. So this is manifested by a tremor, muscle rigidity, slowed gait, masked faces, where you have basically no expression on your face. And then the second one in this category is going to be the tardive dyskinesias. And this is where you develop repetitive involuntary movements over time. It happens a lot in the face and mouth area. So there might be lip smacking, tongue protrusion, chewing, but it's not limited to that. It could happen in any part of the body. So it could happen in your arms, your hands, your waist, your trunk, your legs, your feet, anything really. And this is one of the most challenging ones to treat, which we'll get into in another video. So in general, we can try to prevent these things from happening by using the lowest dose of these medications necessary, and or by switching from a medication that's more likely to cause these types of symptoms, like something like haloperidol, to something that's less likely to cause these symptoms, something like an atypical antipsychotic. Additionally, there are certain medications like benztropine or diphenhydramine that are anticholinergic that may be prescribed in addition to an antipsychotic to decrease the chances of these symptoms developing or to manage them once they have developed. And I'll talk more about the application of those to each of the different symptom manifestations in other videos. But these symptoms certainly can be debilitating, and it's really important that a patient is counseled about the risk of them before they're starting on one of these medications. So I'm going to stop there for now. If there's any specific questions you want me to address in the other videos, put those in the comments. I'm also putting together an email list for those of you who may be interested in my content, because I may have future offerings or resources or courses that I want to communicate directly with you all about. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.